Good evening to members and guests here in Percival House and those joining us remotely, and a warm welcome to the public watching on YouTube. Welcome to this meeting of the Strategy and Change Scrutiny Panel. It's a hybrid meeting and I confirm we're quorum with at least 3 members present in the room. Before we begin, I'd like to welcome our guests this evening. Dr. Joe Howard from the Institute of Development Studies, academic partner for HDRC, and we have community researchers from the HDRC Participatory Action Research Work Stream. So we've got Anne Jacqueline, Shakira Hanif, oh she's not come yet, she's on her way, and Maria Minhas, maybe. Right, and sorry, what's your name then?
Sorry, I'm Vice Madam Consultant in Public Health.
Oh yeah, great,
Council,
great.
yeah. Brilliant,
thanks. Good, and we also have Councillor Polly Newstub, the Cabinet Member for Healthy Equal Lives, is with us in person, and Councillor Blarina Oshani, Cabinet Member for Thriving Communities, is online. Great. We also have service officers, Amanda Askham. Yes, Bashana B. Madden, so we got there, sorry, and Kerry Deacon. Yeah, great. Apologies for absence. I have had apologies from Councillor Midder. Are there any more apologies that we're aware of? No? Okay. There are no urgent matters. Does any member have a declaration of interest in relation to any of the items on tonight's agenda? Not seeing anything here. No. There are no matters to be considered in private. Minutes. We've got the minutes of the Strategy and Change Scrutiny Panel meeting held on the 7th of October. Are there any corrections or comments? No. So can we agree the minutes as an accurate record? Agreed? Good. Good. So we now turn to the panel work programme report. Yeah, we have the there's only one remaining meeting, but if there are any comments on what's left of the work programme for 2025-2026, which is the Appendix 1 to this, I should note that regarding the site visit to observe projects in Greenford, we haven't been able to secure commitments from groups for an in-person visit at this stage, but it's hoped it can be revisited in the new year. Great. Yes, Councillor Taylor.
Wrong one. Is it?
Yes.
Okay. The community charter on it, just to clarify, because there was something else I saw recently about regeneration community charter as well. Don't explain the difference in it, but which one we talk about in relation to this panel? Or maybe you want to explain it, it's up to you.
Yeah, thank you. So the community charter is the overarching charter that we've adopted in council last year, and then the regeneration community charter is the service version is a subset, if you like, of that community charter.
Thank you. So the Health Determinants Research Collaboration is an initiative funded by the National Institute of Health Research, which has granted £5 million over 5 years to build the research and evaluation capacity of the council. We are a partnership collaboration between 3 universities. That's Institute of Development Studies, so Joe, who's online today, is part of that, Imperial College London, and the London School of Hygiene and Tropical Medicine. And we're also working in partnership with 3 community sector organisations, Ealing and Hounslow, CBS, Saffolk Community Alliance and GOSAD. together with the council to do this work together in partnership. So this is the end of the second foundational year. We've had a really productive and fruitful year so far. I think you've seen the documents, so I'll only highlight some key progress measures and then pass on to my colleague Jo and also Anne to talk a bit more in detail about the participatory action research work. And welcome to my colleagues, also Shukri, who's one of our community researchers. Hi, Shukri, who's joining us today. So in the first, I guess, we're orientated around 5 work streams. So this year, one of our foundational work streams is around building up structures and processes. We've had a real recruitment drive this year, so we've been busy recruiting to this new HDRC team, and we've got some fantastic colleagues in post with us to start particularly the training and capacity building work. In terms of workstream 2A, Jo will give an update on the participatory action research project, which went live in January, but a lot of pre-work in year 1 to get us to this stage. So I won't go into detail about it. Workstream 2 is around data linkage. So how do we better link up both council data sets, but also working with system partners like NHS. So we're piloting an approach to link children's social care, education and NHS data in Ealing, which is quite a big project and piece of work. We're working with Imperial and North West London Integrated Care Board on that piece of work. That's progressing nicely, but it's taken a lot of kind of steps to get to where we are. In terms of the third work stream is around evaluation. So we've really focused this year on embedding a learning approach in terms of our whole programme of work. We've spent a lot of time developing our own measurement, evaluation and learning plan, which we're now implementing so that the approaches that we test and learn as we go along, and we're embedding impact and learning logs through our collaboration partners and have a developmental evaluation focus. So not just an evaluation at the end of the 5 years, but evaluating and learning as we go along. And workstream 4 is around the training and capacity building offer, focusing on not only council staff, but also the voluntary and community sector. So we've co-produced that strategy and delivery plan with our academic and community sector partners. We're starting to test out our training capacity building offer with council teams, early adopting council teams, such as the climate team. We're having conversations with housing and also children's services. What we're really keen on in terms of council staff capacity is not is sort of learning by doing and kind of making sure research and evaluation is part of the day job, and will help council teams embed evaluation and learning into projects and pieces of work they have to do anyway. In terms of kind of what's gone well, we really think that this has given us a real solid foundation to go into the next step. If you could see the theory of change in terms of the slides, where we have entered into this next phase, which is much more about bringing a tangible offer to staff and residents. And I think the strength of our collaboration is really strong. We've got really fantastic partners like Jo and our community sector partners, really fortunate to kind of be working alongside them in this work. Some of the ongoing challenges, I guess, for the programme is firstly around capacity. So capacity, it remains a challenge, particularly when engaging with busy frontline staff and voluntary sector providers in terms of how to really make sure that this work is valuable to them. And I guess we've also only recruited our communications expert around summertime, so we're starting to develop our website, which hopefully goes live in January, and also more assets to make the project a bit more tangible, concrete, and kind of easy to understand, because it is a complex multi-stranded programme of work. And as part of that, we are kind of renaming it as a co-branding with the HDRC title, which we have to have from NIHR, Evidence and Learning for Health, with a strapline around translating knowledge to action for healthier communities in the London Borough of Ealing. So we'll be launching that a bit in January alongside the next phase of work, which I can share. I don't know if you want me to kind of talk to questions now, or move on to Joe? Should we move on?
I think, yeah, I think if we take all the presentations and then ask at the end, great.
Joe, over to you.
Thanks very much, Vaish. Can everybody hear me okay?
Yes.
Wonderful. Okay, well, thanks very much for having me today at your meeting. I'm just going to briefly give you an overview of what participatory action research is and why it's useful for the Borough of Ealing. So participatory action research, for those that aren't already familiar with it, is that it brings together people with lived experience of the issues themselves into the research as researchers. So traditional research has people who have experience of the issues as data, as providing data, whereas in a participatory research approach, community members and people who have lived experience of health inequalities in the borough are researchers. So that means that we use methods which enable people in communities to engage in the research and for their knowledge and experience and their worries and their aspirations to be recognised as sources of knowledge for the research that we're doing. And so our community researchers in this programme have collected stories from people in their networks. We have a team of 22 community researchers. What participatory action research also does, it enables the community researchers to analyse the data as well. So they collect the data and then they also analyse it, which means that they're bringing their knowledge and experience to identify what's important and what matters. And they do this as a group so that they bring a diversity of perspectives to analysing the data and to also thinking of potential solutions. So in our kind of team, our cohort of researchers, they bring their life experiences, they bring their professional experience. A lot of them have really relevant professional experience, especially Anne and Shukri, who are in the room with you today. Their passion and their networks are all brought into the work, and this is going to really enrich Ealing's approach to researching and addressing health inequalities. And I think another point is the approach that we're taking is a systemic approach. So we're using participatory action research in a way to help us to understand systems and how, so because people experience health inequalities or the drivers of health inequalities are not always obvious, and there's a whole lot of intersecting and complex drivers in people's lives. And this kind of approach to research helps to uncover them and also to uncover pathways towards solutions. So where we've got to, and I'm going to hand over to Anne and Shukri to tell you a bit more detail about the process, but just to say that participatory action research, as in the name, it's also about action. So the knowledge and analysis that our community researchers are generating is going to be, we're just at the stage where we're going to be inviting in people, officers from the council and from the voluntary sector to come into dialogue with them, and so that the professional sources of knowledge can be in dialogue with the knowledge that the community researchers are generating, and they'll be able to then plan together and take actions together. So we've had a series of steps, a process which started off with recruiting the community researchers, which I think Shukri's going to tell us a little bit about how the motivations of people to join this in the first place, why they were motivated to join it, then a bit about the steps of the process itself, and then where we've got to now. So there was a process of gathering stories from people across across Ealing, and then forming the action research groups, which is the stage that we're in now. So I'd like to hand over so that you can hear from Shukri and Anne, and who please let me know, Shukri and Anne, if you want me to add anything else. But I think it would be great to hear from you too. Thank you.
Thank you ever so much, Joe, and the other team who are getting engaged for this scrutiny meeting. I'm really very delighted that I have been invited for this scrutiny council's meeting, and it's my first time. I feel that I'm being privileged as a community research, and I'm so delighted that my background is from refugee, and I arrived in the UK 2011. Didn't have any skill. I didn't know English, so I tried to establish myself, learn, make every effort. So in the last 12 years, since 2011, I was working in the voluntary sector, and I started volunteering role, and then I developed my skills, and I gained a different qualifications for me to be able to be advisor in welfare system, and I'm now a fully qualified advisor. And I base at LIDA Center. We cater for different works in the community. At some time, I was so glad that it was only the last Friday, 28th of February, that I was able to be qualified interpreter. And I get a diploma in different settings. So also being part of community researchers is really giving me a lot of opportunity to be able, to make a positive contribution to the community. And our office is so overwhelmed. We are based at LIDA Center, LIDA Resource Center, and we see a lot of clients, and we are the frontline volunteers who are dedicated helping support the community. And every time when we get a lot of referrals from the council itself, so it's like a traffic flow that we just cater different people who are having different issues, housing, different benefits, debt matters. So that's where my motivation came from, because one of my colleagues, who is also part of the HDRC partnership by the name of the organization is called GOSAT. My colleague Mukhtar invited me, and he told me, Shukri, you have been engaged in this community work for a long time, and I feel that I should have to give you a privilege to invite you joining this community research groups, and I feel that you have a potential. So would you mind if you can, consider accepting this offer? I said, okay, why not? I have to grab the opportunity while it's there for me. So I didn't have any clue join at the first time, but I have gone through the selection process. Then I did my application, so we have been shortlisted. I was lucky enough that I was one of the community researchers who has been given opportunity to participate in this research. And I have met a lot of friends, colleagues, and we have mentor tutors who are so helpful, like Joe, Maria, and other teams. So we are now 22 researchers, and we collected, I think, 151 stories. And all these stories has their own impact, different mixture of feelings, their life, their lived experience, because we already established the trust that they give their information, and we analyzed those stories, we mapped, and still we are progressing. So I feel that we will make a difference, and also we are more than happy to collaborate with the council. So that's my driven motivation that I interested in joining it, and I have gained a lot of knowledge as a result of that. I feel that I'm more high profile in different departments in the voluntary sector, and then they tell me, oh, Shukri, you are one of the voluntary sector before, but now you leveling up, being one of the community researchers in Ireland. And also this research is also important because statistical wise, and when the council wants us to make a reform to the new policies, we understand that there are a lot of overwhelming situations where clients, just when they come to the community organizations, they have a lot to say. But on behalf of Healing Course, we're trying to accommodate, give them comfort, and you deal their different cases. So I know as a refugee background, not having knowledge, at the first time, and where I am, I'm so delighted that I have been given this opportunity and be part of this scrutiny meeting the first time ever. And it was always my dream that sometime in my life that I will be an active member in the community. So I'm so glad also that my GB surgery head, Dr. Muteza, is here and part of the Healing counselors. So I'm really privileged. I'm so satisfied that how far we have gone, and that our mentors are helping us support and hopefully that we will collaborate with the council, and it is partnership as well. So let me not prolong my speech. So thank you ever so much. I hand over my colleague, and thank you. And you can correct me if, in case I have made some.
No corrections required. No
you.
corrections
Thank you,
required. Very clear. So I want to talk to you a little bit about the methodology that we've used and where we are now, and what we're doing next. So as Shukri said, or as Joe and Shukri said, between them there are 22 of us.
Yes.
We represent the 7 towns of Ealing. We are different ages, we're different cultural backgrounds, we have different interests. So we're about as diverse a group as I think you can get, which has been absolutely fabulous to be part of. The researchers worked hard to recruit people who have a diversity of interest and background, some people who work in the area, some people who have issues with health determinants and social issues, and some of us are actually very privileged. And what we've been done is that we started by having some underpinning training about what are the social determinants of health. And we were then encouraged to not think about the project in terms of just health and social determinants, but we did a lot of work to be trained in what is the power of storytelling and how do you get from people a disclosure about things that are important to them without setting an interview schedule, which we all know that the answers you get reflect the questions you asked. So we had a lot of training working together as teams and taking stories from each other and encouraging us to ask open questions along the lines of, tell me about your experience of living in Ealing. And how do you find it? And then we were encouraged to then ask deepening and other questions because we understood what some of the social determinants might be to draw out people to tell things about their lives. We were encouraged to go to each of our local networks and communities so that we'd got the representation through the researchers, so that between us we have a mixture of genders, ages, cultures, backgrounds and geographies. And we did a lot of practicing between us and learning how to do that. Then we went out and piloted the methodology. And so we didn't interview. I keep saying that because it's long-winded to talk about being a story collector, but we went and talked to people in our communities. We collected their stories. We were trained on how to record them and use the AI to actually do a transcript. We then had the transcripts were all quality assured by the research team that read every single transcript. We were then trained to turn the transcripts into stories to anonymise. So we took out irrelevant detail. We took out names of streets or towns or people, and we changed people so that nobody could be identified, but that we held the nub of the story, and they were very varied. And we aimed to get 150. I think we did.
Yes,
we did. We then had to come in and have more training that says, now you've done that, we want to train you to understand factors. So each of these stories will have things that have happened, events that have happened, important things, less important things, and we'll have outcomes. They'll be positive, they'll be negative. But can you, in each of the stories, and we will put together as pairs or 3s or 4s, to analyse the stories in terms of factors and build relationships so that we could extract back to the social determinants of health what people had told us across these 150 stories. We then, and for some of the that came to the big open event, we then stuck, I can't remember how many sheets, the sort of, the size of that wall, sheets of paper, and we mapped out every single story. We did mini maps of 150 stories. This happened, this caused this caused this caused that in somebody's life. We then drew it all on a board, chaotic as different teams went in to draw their maps. But what we ended up then was a pictorial view of 150 people's stories from the borough, analysed in terms of what were important things that had happened to them that they'd chosen to tell us. the variety was huge. And the way we'd done it visually, if lots of people had talked about it, it had a really thick line. So instead of, drawing a causal effect. And so you could stand back and say, what were the big themes that came out from these stories? We then said, okay, so of those themes, what might be the areas that we take on to the next phase, which is the phase we're now in. So we completed that in the summer. Then we had to start to say, well, how do those cluster? What would be things that people have learnt about, either from their professional experience, their personal experience, and the stories that had come out as major themes? And we'll form a number of action research groups. And so we're currently at the setup phase. Well, no, we're a bit into the setup phase of action research groups. We have 6 action research groups, and our topics, which I think you'll find interesting, are one is green spaces. One of the great things about the borough is the number of green spaces, and it's one of the great things about the council, and people are interested about living in Ealing, but people are interested in some of the less good bits and how you might improve them, and taking the positive and the negative comments, try and look at that. It came out as a real positive, but people have some issues about safety, security, some other things. There's a lot of stories that start to talk about how we look after our young people and thinking about youth centres, youth activities, and that overlaps with the green spaces and the antisocial. And of course, the kids are all hanging out in the parks if there's nowhere else to go. So, but that's a separate group. Language barriers came out. We've got a group looking at that. And one of the things we learned about language barriers is whenever somebody found somebody to help them get over their language barrier, their world changed. So it was about, as soon as they got some access, people's stories changed. They were just amazing. So many people appreciative of living in the borough. But the difficulty they'd had in doing some of this, domestic violence came out, terribly emotional for us all. This was really difficult stuff to do. People were very open with us about what happened. Unsuitable housing was a feature for some people. And then the one that Shukri and I are interested in is we've pulled out a theme which is about referral access and signposting, which came from so many people through the story say, once I found Devinder, or I found this support group, or I found that, my life changed. So we're really interested in thinking about how well can people find the access and the signposting they need and we're narrowing it down to children with neurodiversity and special education needs, because some people got their stories from the occupational therapist changed their life, some it was the dietitian, some it was the nursery, and some it was a parental support group. So it's extraordinarily complex. And how do we help people get there quicker? Because many people talk about a long time before, and then when they get the help, it revolutionises their lives, and they're all appreciative. So there are 6 groups. We are currently at the stage of narrowing down what it is, the topic is, and we're now doing our stakeholder analysis. And we met on yesterday, we had an all-day meeting yesterday, thinking about how we're going to get people from the council and stuff, but also our community and volunteer partners are very important for some of the groups more than others, to start to say, well, this is what we're interested in, this is what we've learnt, what are you doing, and is there anything we can do together that what we've learnt in research can inform your work, and is there anything we can actually do or whatever, but sharing the research in a live way with people who are just, like Shukri, just really committed to doing this, and because everyone's just really, really into it. It's all very enthusiastic. And so we found out yesterday that our original timetable was to finish at the end of March. They found the money for 2 more months. So we've now got 6 clear months to get our stakeholders sorted, and then in January start really engaging, and then we'll have a sense of what is the art of the possible. Can we actually make any change? Or can we just share the research? Can we continue? Can some way these 22 community researchers have had all this time and effort put into them? is there some way that this work can be continued so that we really have an impact on this or other future projects? Because that's what most of the community researchers want to do. And we've had no fallout after the first month, and great attendance and great engagement. And I'd like to thank you, and I've probably overrun, but thank you.
Great, thanks. So we can move to questions. Yeah, I'll take Councillor Mataza first.
Thank you. First of all, I am sorry I'm late, and I need to declare my conflict of interest that I work as a general practitioner provider in the Ealing Borough. Shukri helped me for that, reminding me. Secondly, this I read the paper. It is fantastic. It has quite huge strengths. For example, engagement of the community, collaborative approach, capacity building, and especially focusing on the health inequalities. But there are some weaknesses of this process as well. For example, we limited resources, communication challenges, as you mentioned. And then there are limitation of data collections and potential biases, because personal self-reported data and selection biases can influence the results and analysis, and then the results generalizability. So are there any efforts we are putting to combat that? Thank you.
I can make a start, and then perhaps Joe might want to come to that point. So I think in medicine, public health research, there is a tendency or bias towards more like quantitative, positivist data. So our data linkage project is focused on the kind of quantitative data linkage and strengths. I think we're trying with this approach to kind of redress the balance a bit, because actually qualitative research from a kind of research philosophy paradigm has value in its own right. And I think it comes from a different, I guess, school of thought about what constitutes reality and the nature of evidence. So it's a bit more of a philosophical kind of discussion, I think. But Joe, do you want to chip in there and help me out?
Yeah, thanks, Vaish. Very much appreciate that question and that reflection and question. Thank you. So as Vaish is saying, absolutely right. It's a different paradigm of research. It's a different way of thinking about how we construct knowledge, and it doesn't seek to be representative. We have survey data that can do that. It complements, it gives you a different perspective on, and it helps with the why questions and the how do we questions. So we can understand a phenomenon through a survey data, what's going on, but why it's happening the way it is, how it impacts on people's everyday lives, and how they might overcome it are questions that are better explored through qualitative research, which is participatory research can engage with surveys too. And so we want, in the next phase of the research, or as the action research groups engage with other actors, with people in the council, with people in the voluntary sector who have other sources of data to think about the issues that they're looking at, they will be engaging with other sources of data. So they'll be combining their own the knowledge that comes from people's perceptions of health inequalities, at least the stories that they've told about their lives, plus the experience of the community researchers, because they live, and a lot of them, like Shukri's testimony just now about how she's working, so she has this lived experience and professional experience that she's using around these issues. So she's bringing that into the analysis as well, which is helping to inform what we might do. Right. And we know that health inequalities and the social determinants of health are really complex, and there aren't simple, straight linear solutions to these, but that we need to think about pathways and to test out pathways. And that's another benefit of this kind of approach of participatory action research, is that we take little steps and test things out. And so we keep piloting, and like Vaish was talking about earlier about that, having a learning approach. So if we try this out, will it work? So it's really about bringing that a different way of thinking about research into to complement other sources, other approaches to research. Thanks.
Yeah, I'd just like to ask a follow-up to that before we call other councillors. I mean, I entirely understand that there are different approaches, but if you have, so you've got 22 community researchers who are reaching into their own personal networks. So how do we know that the 6 research action groups that came out of the process aren't kind of heavily influenced by 1 or 2 of those having particular atypical friendship group kind of thing?
They start and maybe go into Jo. So I think the themes, and I think Amanda and Carrie who saw the systems map, that there was nothing that didn't resonate with all of us, and Polly also, Councillor Newstep also, around key common topics around housing, domestic violence. So these kind of themes really resonated with all of us and were no surprise. In terms of the choice of the 6 action research groups, my understanding of the method is it not necessarily about representation from a kind of quantitative perspective, but about resonance with the people that are leading this piece of work, which is the community researchers. And if they bring their kind of passion to these topic areas, that's going to drive kind of forward deep change. Yeah, I don't know if colleagues want to add.
Well, I think I'd add, because I have a background in qualitative research from Imperial College Healthcare, and I liken some of the work we're doing to much more an improvement science approach, which is you don't try and do a big data set and do a big management of change, but you do a plan, see, do, act, where you're finding something that you know is wrong, because it's in front of you. Doesn't matter if it's representative, it's gone wrong in one area for one person, and there's a sense that we got more than one story, then it's something that can be improved, and that we can focus on how do you begin to improve, and how do we use this approach to work with the council staff and community staff to see how we could practically make any improvement that would make life better for the community. So it's quite different to a big research paradigm, and that's how I think that we're edging towards it. And we have had people, we've had Vice and her colleagues come along and do some training and teaching with us, and give us some sense of what were the important health determinants, so that we were, as we took the stories, trying to make sure that we got as much useful information that related to the structure that we've been given beforehand. I don't know if that's helpful.
Yeah, so following up my colleague Anne's brief information, these stories that we have collected are the service uses within London Borough of Ealing, and professionals who are catering for them in different walks. So maybe because of health determinant, some of them have issues with housing issues. They have long-term conditions. Some of them are mental health sufferers. So it's lived experience what we just balanced, both the service users who are still supporting the professionals. And these stories, we have got their own consent that we can share the information with their consent for monitoring and evaluation reasons. And sometimes they are more than happy also to come and share their stories. We can use as case studies, which we have already demonstrated a live event, a case show. Was it in July? Mm-hmm. July, yeah, in July. So thank you.
I mean, certainly, I think the 6 groups that came out of it are ones that resonate with everyone. Councillor Newstep, you wanted to come back on that?
Yeah, I suppose that's the important point. We've got decades of taking like large data sets and then telling people what what the answer is to the problem, without actually exploring why and how it's happened, and having the perspective of the people who are living with whatever that health outcome might be included in the debate. So for me, it feels hugely complementary to all of the wider principles of public health and everything we go into public service for. And it shouldn't really be rocket science that we need to think about how we embed the lived experience of our residents. But I think, system-wise, and it's not an Ealing thing, we probably have forgotten how to do that effectively. And this is really about teaching us, again, as a system, not to look at an individual just as a set of symptoms when they arrive in the GP surgery or worse in the hospital setting, is to go right back and try and think about how, as a system, we can be engaging with people much, much, much earlier. So I have loads of things to say, but I'll leave it there on that point.
Thank you. And Dr. Howard, you had your hand up as well.
Thank you so much. Councillor Newstab has very much said what I would wish to say too. Thank you so much. But I just wanted to add that the one thing that we did was that in the mapping that Anne described, we were looking for the causal factors. What are the drivers? What are the pathways? Why does one thing lead to another? To try and understand the drivers and the causal pathways. And that's something that we can do through stories and through qualitative research. I think that's a key point. And the other is that it's also this, I think this programme is about research, but it's also about council community engagement and how that can be, and that I think that was put by Councillor Newstab, but that, and we had a story yesterday from one of the community researchers who said when he collected a story he spoke to somebody in his network who shared their story, they felt that they were being heard and that, does the council really want to know about me? And it was in a different way because they wanted their whole story and not like a data, either a collection of specific symptoms or to do with a particular project, but about them in a more holistic way. And then we're building capacity and skills and recognition of community researchers as people who do research and not just a source of data. And I think that can be quite transformational in terms of how people see their relationship with the council. Thank you.
Thank you. So I've got Councillor Mohan next, and then I've got Councillor Ryan and Councillor Sharma. So Councillor Mohan.
Thank you, Chair. Very interesting and very unique kind of project. Thank you very much for the report. I have a few questions. First is about how do you advertise the project? How do you reach out? And what sort of incentives and rewards are there for the researchers? And how do you balance representation, given that there are so many communities in Ealing? What sort of support network is there for the researchers in terms of counselling, and because there is emotional stuff involved?
Thanks. Quite a lot of, I think it's 4 points there, but if you
start and then
want to start, yeah.
Shukri carry on. So if you were referring specifically to the participatory action bit, yeah. So I think we have a voluntary sector, a community advisory group to this work stream that really helped in suggesting the approach for recruitment, which was not a big call to residents, but a sort of a nomination process via our existing community sector partners, and more broadly to kind of, so how Shukri would describe being kind of nudged into the project via a colleague from GOSAD, that kind of approach, I think, to these kind of amazing people out in communities doing the work. So there was a sort of nominations process and then a selection kind of group interview process as well. The community researchers are paid so it's above the London living wage. I think it's about
it's £145 a day, which is based on the National Institute of Healthcare Research. That's their rate for patient and public participation. So it's a standard national rate.
and we're being contracted through one of our community sector partners, so they kind of sort out the payment system. So they are being paid for their time, which is really important for us in this work. Support, do you want to talk about that kind of?
Yeah, because I like the idea that because it's inclusivity, and I like that that we hold our different events, different community centers. Yeah. So that we network with the local residents, so that we can benefit, and they already know our engagement to the community. So that's another kind of community engagement.
Yeah, and in terms of, I think I've missed the third point, but for support for the researchers, the team that Jo is from are very skilled at building teams and teaching and training methodology, and they work very hard to put us together to get to know each other, so we can support each other. And as we go forward, and then occasionally we've had additional support. So we've had somebody from the council, a clinical psychologist, I think, talking to us about how to deal with trauma, and we've had some stuff about safeguarding and how we would deal with that. But we have the researchers staying very close to us and checking that we're okay and being available for any storyteller that was upsetting. But also we've done a lot of supporting each other. When you can see when somebody's sharing a story or doing something, it can be very, very upsetting, but actually we all know why we're there. And so, and the great thing actually about most stories is because of the format we did it, most people had a silver lining. So it was a very special thing to be involved in, because despite all of that, they were grateful for something. And there was some sort of really strange stuff about human beings that can be grateful in difficult situations.
Thank you. I think the third part that we've not responded to is the how it was balanced between different all the different groups in the borough, wasn't it? That's right, wasn't it?
Yeah, and I think Jo can answer that. In part, it was some of the nominations of different people being picked, but Jo did the selection. We might have been nudged to apply, but it was a formal application process and a formal interview process, so that you didn't know that you'd got it just because somebody suggested you'd be good at it. It was a separate application process. But Jo, I'm sure you're going to talk about how you got representation.
Thank you. Given that it's hard to be truly representative when you've got 22 people, but we developed selection criteria together with our advisory group to think about what it was, and then we weighted certain characteristics, certain criteria, because we wanted to appreciate and value lived experience of health inequalities. We wanted representation from across the 7 towns. We wanted diversity of cultural background, also gender. And so we had various criteria which included representation across the 7 towns. We don't have the same number of researchers in each of the 7 towns, but we do have researchers who are residents in each of the 7 towns. Thanks.
Thank you. Councillor Rai.
I think some of my questions been answered, but I'm still not clear about the sample in terms of the stories that you collated. How did you select all of those? Because my view is that people who have been here, different timings that certain communities have been in the borough, will have different health determinants. So did the research focus on that as well? For example, if you're fairly new in the borough, you're going to be very concerned about kind of basics like primary health. Whereas if you've been here a lot longer, there might be other things that might be more important. So I'm just wondering how you managed to do that. But I'm also really interested to know whether some of the older, more established minority communities communities were truly represented in this survey. And I think that's something that people here have been trying to find out, but maybe we haven't been very clear about it.
So I think, as Joe, if you don't mind, I'll make a start. So Joe said it wasn't aiming to be representative.
Can I say I do think it's an excellent piece of work before you give me the answer?
Thank you. Thank you. And I think the sampling, we were encouraged to use our own networks individually to select our samples. We were trained not to ask about health. So we wanted to talk to 150 people who lived in the borough about their experience of living in the borough. And then we would follow up with questions if they touched on something that we knew was a social determinant of health. So we didn't directly ask about health. And not least because we felt that we would get a long litany of your, problems seeing a GP or not being able to get this, that and the other, and that was not the purpose. So we were trained not to ask directly about health and actually not to ask directly about social determinants, but to be as open as possible and then just go where people took us and then do prompt questions. So we didn't try to collect enough diabetics or enough renal or enough anything else. That wasn't part of it. I think everybody had a sense, although we weren't particularly guided. So I think many of us felt we ought to take a story from a man and a woman. I felt I had to take somebody older and I had to take somebody younger and find a whole mixture. And I live in a very privileged part of the borough, and I worried that I wasn't talking to people with health inequalities, but I was encouraged to say, well, people are residents of that borough, so you talk to residents of that borough and see what comes out. And I think, I don't know if Shukra, you want to add about how you selected yours, but some of us formed subgroups where we talked about that because we were quite stressed by it. So
can I rephrase that question then?
Yeah.
So those of you that were collecting the stories, 20, whatever number it was, then did that include members of the more established communities in the borough?
Absolutely. Absolutely. So we've got a Polish chap. I don't know if that counts. I don't know, but sorry.
We've got sort of the old established Polish community, but we also have the younger community. So
we didn't do a stratification and say we needed a different age from each of these groups. We just went to our local networks and concentrated more on who we could find and what they told us rather than what was missing. And I don't think we presented it as being representative. It just is what we found out in this example. So it could well be criticised as a weakness.
Yeah, I guess.
Okay, I think you made that point. I don't know if Joe wants to come back on that or not. I mean, so specifically the longer established communities in the borough. I don't know if you wanted to come back. You don't have to.
I can on that specifically on that. Yes, we have. And as Anna said, we didn't explicitly go for any specific community or try to avoid any particular community. So it's people reaching out through people that they knew, people who were in their networks. But because of the diversity of the group in terms of age, in terms of ethnicity, in terms of community and so on, there is great diversity in the stories. And in some cases, you've got a younger person reflecting on their parents or their grandparents' journey as well. So because it's a story, it's them telling their story. It's not, this is how I access this service. It's about, well, I've lived here for this long and my parents moved here and so on. So you've got a bit of that kind of historical perspective in people's stories, which is often very powerful. And the factors in their intergenerational stories were mapped onto the map as well. What I would say, So that gives you a bit of a sense of how it does cut across some communities. What we can't do is be representative, especially in somewhere that's super diverse like Ealing. What we can do is we could get to a point where we say, okay, we've done this work, we've got these action research groups, who are the important things that we're missing? If we want to do a new phase, should we prioritize certain groups that didn't appear, or concerns that we have? And I think that can come out through dialogue between across the partnership with the council, with the voluntary sector, and with the community researchers. But great question, thank you.
Great, thanks very much. Councillor Sharma, next. Yep.
First of all, thank you for sharing the programme and updating us. I found that very useful and helpful, and I can see that a lot of wonderful work is being done. And I just wanted to say I appreciate and thank you for that. My question is, did you identify any gaps or limitations in any evidence that you gathered, or was there anything that stuck out, any gaps or limitations identified? You've answered this to a great extent in many of the things that you've said already, but is there anything that springs to your mind, just to delve a little deeper? Thank you.
Who'd like to pick up on that one?
No, because because we found out what we found, and because we're community researchers, we've been trained and developing as we go. We're working with experts in study design, and we're working with public health experts here, and we just have to trust that the methodology that's been picked and designed and funded by the national body is robust enough for this to be worthwhile, because it's not really our gift or our job to do anything but try and learn and do our best in doing it, because there are big adults designing this, and we're the sort of the participants going along with it, if you like.
Were there any surprises or anything that was unexpected?
We were all really surprised how diverse the stories were, and how, if you just ask people what is your experience of living in Ealing, the things that came up were, and when we did it to ourselves, the green spaces being important, the Elizabeth line features so often, people love the transport, and what was surprised was the positivity, actually, even as people were talking about difficult things when they started, and because we've been trained when they were going to ask about some support they had to dive into that support. I'd say the big thing was how positive they were and how open people were to tell stories.
And West London has become a very vibrant area, and everybody is, like moving in. And because of Heathrow expansion, everybody likes the transport, the security and the safety. So everybody's now involved. But the stories we collected, some of us were so emotional, and it was triggering us, personally. There are a lot, to take in, but, every time we have been reassured that our health and safety is also important. And we have had this therapist, we had a 1 talk or 2 talks during the test sessions. So even we are still in developing the research. We have not yet concluded, and still we are trainee researchers. We are still in the process. We are learning, and then maybe we can uplift future fundings. Yeah.
Just to for example, you mentioned violence against women and girls, and the diversity. Were there any cultural, insights that you gained, or that came to light, and that were a gap, or or something that you identified that people weren't so aware of before, perhaps? I
think you'd have to ask the people from the council, because the 20 two of us, each of us has a relatively limited experience to our own community. We're really rooted in our community. You can see we're rooted in our age group. So the younger people in the age group, we've got a lot of younger people, have very different experience and interests to the older couple of us that are in there. But so less than seeing gaps, what we just saw was just the amount of information we got. I guess, because individually we only knew lots more about our communities, and Shukri knew a lot about people that she was working with, but less about some of the other people. So, and I don't think we knew what we'd find, but we found so much that I don't think we've stopped to look at that. I mean, I think it's a really great question, but it's not been part of what we do.
Okay. And Amanda, you wanted to come back on that?
Yeah, thank you. So just listening to these questions generally and thinking about the totality of the work in strategy and change and the different things that you've seen coming through this panel, I hope you're getting a sense that in the way that we do our work, we are not just incrementally trying the same thing again, but a bit better. We're really trying a different way of looking at societal issues that we have and a different way of approaching those. So it's very difficult to compare this approach to more traditional research methodologies. And I think probably that question from a council, and your answer was superb. Were there any gaps? No, because you got what you were looking for, which was a story. But I suppose from a council perspective, and you're right to turn that question to us, what we did not know before was some of the causal effects, if you back the story from where a person gets into crisis, and everything we are trying to work on in strategy and change leads the council to a more preventative model. So we're really thinking the next thing, the paper that you'll have from Carrie and other papers we brought here, are us trying to back work where we are and to say, if we can do a little bit in people's lives or connect people to something different earlier on, will it make a difference on their journey? So I think for us, when we saw that big map, which not only told us, I mean, the 6 themes that came out, they are themes that we are all well versed in. We know that those are the things that Ealing communities care about. But what we didn't know was all the different routes that take us into those spaces, and the different routes. It's like a game of snakes and ladders. One person is led into a domestic abuse situation, whereas a slightly different intervention or a slightly better house or a different job or somebody speaking their language at the right point leads them on an entirely different route. And that had not been exposed to us in that way ever before. So this is such an important piece of work for us in developing our preventative model. And I'm hugely grateful to the 22 community researchers who have gone deeply into their networks and sat with people and their stories, and brought the learning for that together using knowledge that only they hold, that we could never have done. So it is a very different way of doing things.
Thank you. Councillor Taylor.
Thanks, Chair. I think well done on partaking in the research. I think it's great that you're doing. I think as political activists, we're always saying that every conversation matters, not whether it's 22 or 50, but every single one we go on the doorstep matters to us as political activists. Amanda's kind of answered one of my first questions, because it is a challenge for the council, actually as councillors as well, about what we do with that information, longer term. And I was going to reference the second paper, but you've already done that, because it was a question of why there's different things going on. The question of this is there, that's there, and how does it all then feed back in better services and better provision that we do. And you've got the connected groups like Ealing, the ACT in the South, or the GMP groups as well, picking up on those. And obviously you mentioned the consultation. I'm sort of like going around houses, but the consultations that we do, I mean, let's just take, it's relevant to me, but housing consultations and what matters to people, and I think 2 questions thinking. One is about the challenge. Actually, you mentioned and how you embed it into staff work. The challenges, for example, we've always done equalities impact training over the years, and how do you embed equalities work? In some areas it's been successful, and others it hasn't. And I'm trying to think how we perhaps going forward engage different areas of the council, or actually maybe the public health and NHS as well, into that and learning some of the issues. But I did note there's one example in the papers, it hasn't happened yet, research here was HMOs, which I thought was interesting because I know it's not happened yet. From a political perspective, I don't necessarily mean just Ealing. There's a challenge of how people perceive HMOs. Neighbours don't want them, but the people living there, it's for affordability, living with strangers. I know a case we had last year of a woman who couldn't speak English. It came to see me, my brother lives in Norfolk somewhere, and how she had to live with people she didn't feel comfortable with, and so then there's the pressure that person go back to housing and say, well, you're adequately housed, we can't help you, but she's then suffering mental health issues as well as other physical symptoms as well. So so there's a challenge, isn't it, you know, between having to deal with housing needs stuff and then these other factors that probably that journey that has got them there in the first place. So I don't know the answer to that question, does a piece of casework, but so hopefully that will add to our policy solutions longer term, you know, not just Ealing, but across the public sector as well. So yeah, so I've gone a bit around the houses there.
So I think there was a question to start with about embedding into staff work, and then I'm not sure there was quite a question in the second half. But yeah, any comments?
So I think I was very interested by that, and I think linking it to your questions were there gaps. I think what surprised us, what we just heard, is that one thing leads to another, and for quite a lot of people, it's just not understanding who they can go and talk to, and how they resolve it. And this real impact that once you find, you know, and it felt a bit like it's round in motion, it's random, that if you happen to find somebody who can then get you to an English language, then you can get a job, or you can volunteer, then you can be economically, then you can look at that. And if you don't understand the complexity of housing, you don't know what you don't know. And that's what some of the frustration is, and what came through the stories was breakthroughs again and again, just with helping people, and that they're all, and it is really, really interrelated, so that nobody just had one interest, and people were very, not surprising, complex and knock on, but breaking into anything to help people begins to make a very big difference to how they feel. And people talk about their confidence and their happiness and their wanting to work and be economically stable. That was across all of the communities, wasn't it, I think?
Indeed. Because maybe, for example, as community researchers, we also work in the community center. For example, maybe organization may make a referral or signposting for one individual, just for one case. That's the inquiry we pick up. As caseworkers, when we do appointment for the service user to do their initial diagnostic assessment, just the first approach for the referral was one case. But when you do the tracing, you realize that the person has homelessness, imminent homelessness issue, have a mental issue, have that matters, you know, have got a family related issue, social services due to family separation or domestic violence. So because we know different service providers within the different settings. So what we can do is what we can prioritize for the first action point, and within the directory system of the service providers, we do samples as and when we can do, because there is a limitation on what we can do. So that's what we pick at different people's stories. And this is a very major problem that we always like to figure out and do the necessary referral and signposting. So yeah.
Yeah, I mean, I certainly agree with that. I'm sure as councillors, we all get casework where, you know, somebody presents with one issue and it actually, you have a conversation and it unravels into there actually half a dozen different issues. Yeah, absolutely. Amanda wanted to come back.
Yeah, thank you. And a little bit about embedding into the work, and then a little bit, I suppose, about your wider question, Councillor Taylor, or your wider thought-provoking. which is really which I interpreted as the question of there are lots of things going on.
Yeah.
Is it fractured or is it systematic? And the working strategy and change is all very interdependent. So anything that we bring here, like I'm sure in other scrutiny committees, everything touches on everything else, and they layer up together. So, for example, if we take that conversation, the stories that Anne has just talked about people looking for information, advocacy, advice. So there are many ways we will do that. So very deliberately taking forward an action set with our community researchers and a group of officers, all of whom are involved in that, where we can go deeply into where it works well, where it doesn't work so well. On top of that, we're looking at, Carrie's paper talks about growing networks. So do we deeply understand where communities are getting their information and their advocacy? Where do they naturally turn to? It won't always be the council. Then a third layer of that is we have our AD of strategic commissioning doing quite a technical review of every bit of contract spend we have on information, advice and guidance and advocacy. Our AD of transformation looking at all the services who currently offer information, advice and advocacy. So all of these things, it's a thematic, but we take it through a number of strands, all of which talk to each other as we go. So I suppose it's some reassurance that we bring thematic themes and say we're tackling this in different places. So, for example, Louisa last time brought cost of living, where we talked about benefits advice in lots of different places and trying to bring that together in a cost of living approach. It is exactly the same around this information, advice and advocacy. So it becomes deeply embedded in our practice, in how we form that kind of web of networks, and in our spend, which are our big levers.
And Councillor Newstep. Yeah, Councillor Newstep wanted to come back here.
I just wanted to, I guess I just wanted to reflect on having been at the showcase back in, was it July?
Yeah.
It was so palpable what a incredibly close-knit and positive group of people you were, and like how much fun you were having with this, you know, even though the stories were sometimes difficult and traumatic, but the connections between you all were incredible, really awesome to see. So I guess I want to thank you for that. And it's my first question was, what's the experience been like as a community researcher? But in fact, you've answered that, and the smiles on your face answer that. And I do really strongly think that this kind of work alongside and as part of the strategy change work, and are being fortunate enough to have great officers like Amanda and Carrie, who you're here from, it is transforming the way we do things within the council. And your work is really crucial to that, because what councils tend to do is be very service-led, and many people, through reasons of trauma or whatever, or historical circumstance, fall through those systems, and then we're trying to pick them up. This is really trying to be much more proactive about how we get people that support and advice at the right time, and without understanding those points at which someone goes down that ladder or they're down that snake or up that ladder, it's very difficult to do meaningfully. So I just want to thank you for that. I did have a slight question. It might be for you, Amanda, rather than for the researchers, around how the work is being received by the staff, and how we it is one of the challenges you've got here about capacity. And I'm sure people who are within your directorate and within the strategy change element are, 100% enthusiastic and signed up. Are you finding that, without shopping anyone, are you finding that that's true across the council? Is there anything more we could do as a panel, perhaps, to make a recommendation that the capacity is found, or that the focus of of different directorates who are meaningful in bringing about that change properly engage with the work of the researchers?
Yeah, thanks. It's a good question. I think probably in a lot of our work, which is about moving into that more preventative space that some people would call upstream of crisis, a lot of our teams find that very challenging to think about that at the same time as a constant context of response to crisis. So I think in terms of that capacity, it's always a little daunting to step into a room and think, what can we actually promise in working deeply in that preventative space? Are we suddenly going to be pulled away to a crisis? Can we really engage in there? So I suppose a recommendation that says supporting that teams will engage deeply in these. I think the most important thing now with this work is that we, the council, show up to it and step into those action sets in a really broad-minded, bring the best of ourselves, and accept that there will be criticisms, positives, lots of learning to be done. So I think a recommendation there, and that would be really helpful. Thank you.
So I didn't quite capture you were saying about supporting, engaging deeply. I didn't quite pick up exactly what the recommendation would be.
I think the recommendation is about commitment. You know, we need to be committed to these action learning groups, and we need to show up there well. Yeah, seeking commitment. What we don't want is a bit of a half step in and then return to daily life. We want to let's have some people in these groups staying with it until we find some good solutions and some ways forward. So it is really about commitment of capacity and sort of emotional endeavour.
Okay, thanks. I think we're running out of time somewhat. I've got Councillor Rice who hasn't spoken yet, but I'm afraid I'm not going to be able to call others who've go already. Sorry about that. Councillor Rice.
Thank you, Chair. Because I'm just thinking back to when I used to work for the Metanoia Institute, training in psychotherapy and counselling, and how those who came along to do training courses had to have therapists. And I couldn't actually understand why, but it was in order to help people work through their own issues so they could talk and help other people. So I'm just wondering what kind of support that you might get, because you're talking about issues like domestic violence. Well, in theory, you could have those kind of issues going on yourself. And how do you have that support in order to deal with the situations that you might end up speaking to people about, which might really be too close to home? Thank you.
Good pick up on that.
I think Anne mentioned before we'd organise sessions with a clinical psychologist who was based in children's services, who's an expert in, I guess, trauma, and she had the bespoke session about trauma-informed research, which gave some sort of strategies for kind of well-being and how to kind of process difficult conversations. So I don't know if you guys want to.
So I think, well, we did discuss it. We talked in terms of thinking about where you might meet somebody to do a story, how you might bring it to a close, how you might think about closure for yourself, how the people from the IDS, Institute of Development Studies, how they would be available as a team and would take calls immediately to support anybody and be available for that. And I think we also helped each other as we were, because as you've observed, that when we were, say we were mapping a story and it was upsetting, there was some time and space. So we had occasions where people took some time out and then were supported by other people to come back and do that. So it was anticipated, it was trained for and thought about, and there was quite a lot of work put into looking after yourself. And then when we did the training of the stories, we took stories from each other, and it was an amazing experience. We had several people who told what was to them personally traumatic stories that they'd never told to anybody else. But actually we used that as part of our skill development to support and be empathetic to the people we were asking stories. And we weren't trying to do therapy or solve anybody's problems. We were just saying, tell us a story and it's okay to stop. It's okay to stop at any time. And the information sheet was all very clear about that. So looking back, I think we had a lot of preparation for that. And then when we'd done one or two pilot stories, we then came back and did some more. So I think we all I felt very supported. And actually some of our researchers were more robust because they came across this more through their own lived experience. And actually they seemed to take it in their stride better because they were familiar with some of the stories. I don't know how well that's answered the question.
Yeah, that's great.
For us to get engaged the community, it was a lot of things we were asking, but for us coming together as a community researchers for different background, different culture, you know, and growing up, bringing a different environment was an issue. So we worked how we first establish ourselves, getting to know each other. So we, the first few weeks of our training, we did a role play just to start from us, you know, establishing the connection and trust. So we did a role play, just getting to know each other. So we did individual sessions. So one person, the role play was, one person was the storyteller, the other person was the story collector, and the other person was the commentator. So we were having a cycle of different role play. So which enable us for us to do more into practical. And yeah, it was very fabulous, you know. So that's the way we, that's the way we try. It's just, you know, at the first time you can't approach a person, even if the service use. But the most important thing is that how you approach, and the first perception, you have to tell your story first, you know, so that you can give the storyteller, or that you share a common sense in different ways, you know. So that's our stories were successful, and everybody was interested. Even sometimes when you approach some of the service user or any other, maybe you have a service user and they have a relative or friend or some other acquaintance, and in case they are not willing to share their stories, but they want to encourage somebody else, that's when we just try it and tell our stories first, and how we work, that we are part of the community. And because the reason we are doing this research is that the council will need to hear and listen different life, and how people feel about the council, and for us community engagement, because we said sometimes just we are part of the community, so we need to learn your stories and then take forward to the council, maybe for future reforming their policies and interacting. But first time when people heard about healing council, oh yeah, healing council, you know. But we said, yeah, we are part of the community, so people are willing to collaborate, and yeah, so we started somewhere, and yeah, we would be approaching a high level of, you know, spreading the information to the council. And yeah, this stories will be nice for us to collect more, and that the council will make the necessary implementation in the future. Right. Because it's people's stories.
Great, thanks very much. And Amanda, finally, do you have, no, leave it there. Okay, good. So so now we need to come up with the resolutions and recommendations. I think firstly, I think everyone was very clear that we want to commend this work, and in particular commend the work of the community researchers. So, you know, as well as officers and academic partners. So I think we can all agree with that. So yeah. Great. So I think there was a point that several members raised about whether there might be gaps amongst some of the longer established communities. And I think there's a Joe actually was saying it might be worth in future phases seeing whether there had been any gaps. Would we like a recommendation along those lines? Giving a couple of yeses.
This process will be final outcome, not purely based on this.
Yeah, that's right.
And
yeah,
there are other officers and other elements as well. So
absolutely, yes. Collectively, as a whole, when we look at everything, we want to make sure that there aren't any communities left out. I mean, essentially, yeah. Yes.
Yes, that was partly what my question was about, for the hard to reach people who fall through the net. Those are some of the gaps which are always, you know, very difficult to. So that's part of the gap.
So maybe we want to broaden it. Maybe not longer established communities. Maybe just to ensure that no communities are kind of.
I do just want to add that it's really good to see that technology is being used because you're doing, you know, some of your work has involved using technology. And I think it's really good that the way that's helping you to move forward. Thank you.
Yeah, Councillor Rye.
Councillor Ball, I do think that we should differentiate between the long-standing communities and those that are the new communities, because I think their needs are very different. So I wouldn't like to.
Okay.
I would like it defined, if I may.
Yeah, Councillor Taylor.
Sorry, I'm just conscious that we're not trying to rewrite a methodology here.
I think
just
we're
be
talking
clear.
about in
So,
terms of future.
I know I get
phases.
that in terms of the gaps, but let's not whatever the approach was, sorry to be clear, because there are other programs taking place as well. But I'm not going to criticise what
No,
members
that's right.
have said.
No, we're not critical of this process. What we're talking about in terms of future work. Yeah. Okay. So is the feeling that we should specifically mention the long-established communities? I mean, so you said yes, but have we got more?
Yeah.
You agree?
My own.
No, that's right. So we've got a majority, I think, agreeing with that, making it specifically about those communities. Sorry,
Well, that was
Councillor
the
Newstead.
question we were asking.
Councillor Newstead, did you want to respond to it or no? That's okay. Amanda, yeah.
So I think that point about this methodology is not about saying we can guarantee representation from every part of the borough. It is absolutely not. This is not the way we would go about it if that was the objective of the piece of work. What we are saying is that we will, as we work through these themes and these action learning sets, we will identify if there are any gaps that we think we need to explore, any communities that we think this is particularly pertinent to who have been left out of the conversation, and explore it. So I would really ask you to not use a representative framing of this. If it's about saying this work to be as inclusive as possible of all communities across the borough, that's what it should be, but it cannot be representative of all communities.
I think the idea is that we're talking about future work. We're not just talking about this. You know, we're talking about future work and just broadly making sure that there aren't gaps. Okay, I think we're mostly happy with that. Yeah, that's right. We're not critical of this process.
Yeah, we just want to be a little bit more precise so that if you say representative communities, well, that's a matter of opinion, but we just want to make sure that there's nobody falling through the gaps.
Yeah.
Or a certain section of the communities are not. I know you can't guarantee it, but I think I'm just wanting caution here with work that's going to be ongoing.
Okay, I think we've got that. And then the third thing that I heard was Amanda's own recommendation about commitment to the process. You captured something, didn't you? What have you got there? So it's a recommendation to, I guess, to council officers generally across all directorates to seek. Sorry, hang on. There we are. Seeking commitment to give capacity to this rather than returning to daily life. So it being a commitment to it as an ongoing mindset. Does that work? Yeah, great, good. Okay, any more suggestions for recommendations? No, great. Oh. Okay, well we can note that so AI was used in the process, so we can note that it was making good use of technology. Yes, Amanda.
I was just wondering if I could offer some wording for the second recommendation, which maybe is the most tricky one, which might say something like, in the many complementary research methods being used across strategy and change projects, consider all communities. Too general?
So there did seem to be a specific point about to make sure we haven't missed out some of the longer established communities, wasn't there? That was the kind of, with the context of the rest of it, is it okay to specifically mention longer established communities?
So I think if there is a concern that across our projects and our research methodologies that we are missing people, it would be great. Please do talk to me about that, because that's definitely not our intention.
No, it's not. But okay, I mean, basically, it's up to the members of the committee. Do we think? I think we decided you're right. We just to confirm, we did want to specifically mention, as I say, it's in that context of being about the work in it. Sorry, keep banging the mic. The work in its totality, not about this project, but in that context, do we specifically want to mention the longer established groups? I think I am seeing some nodding. Yeah, I think we are saying that. Yeah. Okay. All right. Let's move on. So those are the recommendations. Yeah. So thank you very, very much to all our guests. This was very, very interesting. As I say, we formally commended your work, and it was actually really, really interesting to hear about it, and really challenging to understand what you're doing. So thank you very much indeed. Great, thanks. Now we'll move on to. Well, that's right. It was interesting, though. It was interesting. Right. So I'll give you a second just to over. Great. Thanks. Bye-bye. Great. So we're now moving on to item 8, which is an update on the Council's work to develop the foundations of place-based prevention. So I invite Carrie Deacon, Assistant Director for Connected Communities, to introduce the report.
Hi, good evening, and thank you very much. I wanted to start with just talking about how, I guess in some ways, it complements the work we've already been talking about. When we think about prevention and changing the way we operate, we should also think about how we both think of the role and what we can change internally of the organisation, but also the unique position that someone like a local authority occupies, and how we can think about the conditions that we can support in communities to support each other. Because we know that whilst demand on our services can increase and increase and increase, unless we come up with different ways of working and getting the support to people as early as possible in ways that mean most to their lives. So we've heard examples of community researchers who had uncovered lots of different stories about where people search for support. Unless we can find those solutions in people's lives, the demand will end up always outstripping supply. We're very lucky in Ealing that we've got amazing community organisations, lots of faith organisations, lots of great businesses and shops across the borough. And that's a great platform to build upon. But we equally hear from a lot of people about where they don't necessarily know where to go for support. So what we're trying to do is think about different ways that we can consider in our towns to strengthen those conditions in our towns for people to get support, for them to be able to develop activities that matter most to them, and create those conditions where people can get help as early as possible. That isn't just reliant on councils or public services, but is in the form that matters most to them. That doesn't mean we won't be helping and supporting those things, but how can we uncover and support that more? So what we're talking about today in this paper is 2 ways of building some of those foundations and building on some of the brilliant stuff that's already happening in our communities. So as part of that wider work of how to shape that, we've been really looking at those conditions. So the first element that I outline is what I've referred to as town anchors and network. Now, town anchors in lots of communities are community organisations that help create those conditions where people know where to turn to. It might be a faith organisation, it might be a community organisation, it might be a GPs, it might be a school, it might be a small business or something where people know they go along and call on support, but they also go there for various various circumstances. Today I was talking to, for example, a faith institution, and they were talking about how they wanted to do more in this kind of way to really support their community in different ways, because they were experiencing lots of people who were lonely or didn't know where to turn to or needed more support in their communities. So great examples across the borough. But we also know that there's networks, and those networks of support exist but are often quite fragile. So when I've been talking to people, you as councillors probably know those networks of people to connect to. But who are those kind of stars in our community who often provide lots of support and connection informally? It might be a pharmacy who just needs a little bit more information to support people. It might be a community leader who does lots in those housing estates. But how can we create those rich networks within our communities and help support that to flourish so that people know and have got a web of support in their lives? So what we're hoping to do is, in Greenford specifically, is to test an approach where we can develop these kinds of town anchors and networks to really grow some of those great kind of community connections, but also allow people to develop their own ideas, grow community power, and feel like people can connect and support each other, and hopefully grow that fertile ground. But that they also know when to call on council or public services as well for support, and can refer on in the right ways where that's needed, but actually where communities themselves can provide a lot of that support and advice as needed, and how brilliant things can happen from those conditions. The second element that I outline in the paper is more focused on neighbourhoods. Now, neighbourhoods we hear a lot about in the press and in public policy at the moment, with things like NHS looking at neighbourhood models. But by neighbourhoods in this case, what I mean is smaller areas where people would identify with each other. Sometimes there are estates or closer communities where we might see higher levels of deprivation going on, and that is a clear driver of what's going on with deprivation. What we're hoping to do is work with 3 neighbourhoods initially to learn how to connect those neighbours together, and also think about how they can be connected to other things going around those neighbourhoods. We know in some of these neighbourhoods they've maybe got less social connections than in some of our wealthier neighbourhoods, and they're using less of the community resources that are at their disposal and could offer real support. So what we want to do is strengthen that with people locally to grow those kinds of things, and understand, like with the community researchers, what are some of the barriers and challenges that people are facing, and how can we help grow the power and confidence of people locally to overcome that and take action on things that they care most about. We know by doing that we can connect people up with schools, with community organisations, etc. as well, and grow those networks of support that are really strong in those neighbourhoods. And we want to learn about, by having those social connections and about having that social support, can we drive change within those neighbourhoods that matter most to them? And that might be sometimes as well pulling on services and support in appropriate ways that might also complement that, but also by growing those conditions in communities, can we help grow change? So these are 2 ways. This is what I would call foundational practice. So it will complement lots of other activities that are going on. But if we can get these foundations right, as well as supporting change within our services, we can grow some of the great stuff that we know really bolsters communities, and that we know that in parts of the country and the world really matter to people. We also know through these kinds of processes, increasing visibility of some of that great stuff that's going on, and where people can get support, that we can prevent more crisis, that people will know where to go earlier when they're facing challenges, because they've got those networks and support around their lives, and that they can call on that support. And if then they need further support, then there are those more formal mechanisms that work well for people. So that is my mini summary, because I'm conscious of time tonight, but hopefully that will give you some insights into why we're hoping to develop this work, and why I think it's growing on the great stuff that we already have in the borough, but strengthening that in a unique way.
Great, thanks very much. Councillor Scrutiny, did you want to add anything at this stage?
No, happy to go to questions.
Okay, that's fine. So first question I saw was Councillor Sharma.
Thank you for your contribution. That was very interesting. And I just wanted to focus on one particular aspect that you touched upon, which was basically working on the individual, about raising awareness and understanding, because sometimes things happen and children are neglected or not seen to be neglected, and and dreadful things have happened. And why didn't somebody spot it earlier on? Why wasn't action taken earlier on? Same for domestic abuse and so on. Why are people getting away with certain kinds of behavior? And I think people just sometimes are not aware. Perhaps that's why. And what kind of work is being done so that people are aware of what's going on around them and how people are treating each other, for example? Professionals, why are they not picking it up early enough? Why isn't it being directed in a way that can be addressed earlier rather than later, or before it becomes a crisis? Thank you.
So a lot of our work is looking more systematically at earlier help. So we want to look at what are the conditions that help create early help. We know that with lots of people, that help might come in the form of, teachers looking at things, or it might be GPs or those formal, but we also know the power of the neighbour and different people understanding what's going on. So for example, I was talking to some of our colleagues in adult social care, and they were talking about some of the risks that if more people receive direct payments and get choice over some of the things that they want to receive, how that could create some risks around that being taken for granted and people taking advantage of people. But we know that actually one of the protective factors is if you've got strong networks around you of people looking out for you or aware of those kinds of risks that people face, the more likely we are to be able to combat that. If we rely on one professional who will have limited contact with anyone ever, in the course of someone's life, that actually they can only do so much. So it's really important that we do support the professionals to do those roles well and to provide earlier help as possible. But how can we complement that with rich networks within communities to really understand what people might be experiencing, what to look out for, how to talk about these kinds of issues, and how to help people find help in the right ways as well. So I think those two things are really important. And we know for many people experiencing challenges, their early help people will start with often their family and friends. So how can we create those networks where more people get to know and understand challenges and can help earlier, as well as those professional networks?
Thanks. Councillor Rice.
Thank you. I'm just wondering, please, about excuse me, how we can work together with other things that are going on in the council. I mean, one example I'll give is how can we use our town teams that we now have. And I mean, what's making me feel excited about that is that we had our Christmas tree switch on in Northolt, and we had lots of those community anchors were there together, having a great time, connected together in one place. We had over 100 people turn up when it was pelting down with rain. So it just goes to show what we could have achieved if it hadn't been raining. We could really help get people together. So what kind of work can we do through the town teams to start with? And also just thinking about the kind of work we could do at other things that we do in the council, such as the High Streets Forum, previously the task force. And one thing that I'm thinking about there is that we want our pubs to thrive, because one thing I find about with pubs is that, I mean, I don't know a lot of people in my building, so I'm not going to go to a corner pub with them and hang out. So how do we bring us together so that we can get to know each other and have somewhere where we can just go and help a place like a pub thrive, because we've got other people in the community to be with there and to be with our local. So I'm just trying to think about how we could just think even just outside the box and what else is going on in the council. Thank you.
That's all music to my ears, because that's the work that I'm doing with the different teams. So you'll be glad to hear that the town teams and all of that work, I see them as kind of all part of the same ecosystem that we're trying to build within each of our towns. So working closely with the community team that you're working with, this will all be part of kind of one stream of development. And originally, when we were creating Your Voice, Your Town, we imagined that there'd be a town team, but also networks of support. And I think this is how we build that. So all complements, and so that town teams can call on that, but the anchors and everything would all be part of that one way for each of the towns to operate. And then the other things are things like the pubs. For example, when I've been up in Greenford, I was walking past one of the Irish pubs and they were like really keen to get us get involved and be part of this network. They could see that they could play a key role in that, but equally a pharmacist or a temple. So it would kind of build on what's there. And what's really important is in our towns, we've got some things which are really different and some things that are unique, that we build it with people who are locally. And the conversations we have is where people identify those things and say what really matters and what they use in their towns, and that we create those networks with people. But then we have those conversations with, for example, the pub or the town team and say, hey, how can we build this together? Certainly with other council services as well. One of the great thing is we've been working across all of the directorates to make them aware of this piece of work, and they all have to buy into it, and we'll see this in lots of ways. They were calling out for this because it really complements that work. So how can our services show up in our towns? Well, it's through these kinds of networks and through this knowledge and understanding in the local areas, but also how can we then feed back up to our services to understand how that will work too. So I hope over time it will become richer and more fluid, that each of the services will know how to use it, but actually it's owned locally by the towns and the neighbourhoods, because that it's their thing, and we're just helping facilitate that.
Okay, thanks. I'm just going to ask a question myself. How will officers evaluate whether these approaches actually reduce demand for crisis services?
These are what I think at the moment is early stage development. So at this point, we're trying to figure out how it could work. So in Greenford, for example, I think of it as like a prototype, the first stage of us understanding that. So we're learning and building how we might evaluate and understand that first. But if we put that immediately on, has it decreased demand on adult social care, that test would probably be not right for where we are in that development. But over time, as we build those networks, hopefully we'll see where patterns of where people get support. In our neighbourhood work, once we've developed how we'll test that, if we were to decide that what we wanted to do was roll out that very deep work in our neighbourhoods, we could say, well, actually, we know in this neighbourhood through the data sets that we have, we tend to get X amount of antisocial behaviour, or we tend to get X amount of demand for certain services, and you can look at how those demand models change over time. So, for example, I've visited councils where they've literally looked at that data. So I was recently speaking to Sunderland Council, and they can show that demand shift over time. But first we need to make sure that our model of how we're doing it makes sense, and that we can find a way to do it before we go to that next stage of evaluation and looking at that front door demand.
And how will the lessons from the prototype work feed into future commissioning and connected communities border transformation work?
Amanda, do you want to come in on any of this, or do you want me to go first? No,
Oh, yeah.
okay. So in terms of the lessons learned, what we're trying to do is understand how we better work in each of our towns and neighbourhoods. So what is our place model? So we're using these tests to kind of shape how we will understand how to create that model more broadly. And at the same time, look at what does that take to transform our services? What do we need to commission differently? So you can imagine in some of our commissioning at the moment, we commission voluntary sector organisations, and they'll be at a certain layer of the system. But are we ever funding or commissioning the layer where it enables those community activities to happen? One of the lessons learned might be, actually, we might need to commission different things in the future. So part of the insights from this are feeding directly both into how we might commission and what we might commission, but also how we might need to transform some of the ways we operate in order to support this stuff too. So all of that feeds in through our processes around transformation to make sure that that learning is implemented both in our model of place, but how we commission and how we design, how we operate.
Thanks. I've got another question for Councillor Sharma. Do I have any other questions after that? Or yeah, and Councillor Taylor. Okay.
Yeah, I'm sort of trying to go back a step, if you like, at the very beginning. So, I mean, I'll just, to make it like a real practical, something that you can connect to. So, for example, we've talked about domestic violence, but there's also what's known as cuckooing, you know, where elderly individuals are targeted and they're taken advantage of by fraud and so on. So, for example, the woman in domestic violence or whoever person in and the person who's being a victim of fraud and so on, they don't know what's going on. They might not even know that it's unacceptable behavior by others. Like a woman may be in a domestic violence situation and she may not know that she has rights and that there's things that she can do to protect herself. So if they don't know, the victims and so forth don't know, and then the professionals who deal with them, they may not be able to expose it. They may not have the expertise, or they may not have the awareness or the training or whatever. And that's why people fall through the net. That's why we can't get to the hard to reach. So what I'm trying to do is to go back a step and see how we can change the approach. This is why I'm talking about raising awareness and understanding, not just of the individuals in the community, but also the professionals as well. Thank you.
So on issues, I think when people, there's some areas that we're looking at developing through this model is what I would say creating some of the conditions for help. But what we can't do is obviously if people aren't in an understanding of where they are in a crisis point, we do often need professionals to support people in crisis points and what that looks like. And then they have that network of support. Where people become aware of these kinds of issues is really important. So previously at another organisation, I worked on some of that fraud prevention work with networks of support. And actually it was only by hearing from trusted neighbours, people could develop the skills to know what to look out for and how to kind of reduce the risk of that. But by going neighbourhood by neighbour by neighbour, actually that came from a trusted support. Too often in public services, we often put out campaigns of information and flyers. They may be in surgeries or on walls, but actually it doesn't necessarily mean something to you. But if we can get those connectors in the communities through the network who are trusted within their communities, a bit like we were describing with community researchers, where they can reach people that most services and most things don't, then actually that's how you disseminate and help people prevent those issues in the first place. It's not going to be the full answer, but it is a really important part of that mixture.
Great. Okay, and Councillor Sharney wanted to come in on that.
Thank you, Chair. Yeah, so just to say that I think there are occasions when people don't feel comfortable going into sort of council spaces per se, you know, spaces where, you know, there are council officers or that kind of official sort of environment. And I suppose this is where we are supporting people through informal environments. I mean, we talk about some of our sort of libraries, some of our community centres where people sometimes feel more comfortable to go, and actually those are the ones that we want to support, because a lot of these are doing some fantastic work in, for example, elderly people and loneliness. You know, our local libraries are running sort of coffee and tea mornings for elderly people, and it's about us being able to support that kind of environment in our community spaces and in places where they're happening, and be able to sort of get out of the way and let them get on with it, but also to support them. So one way we can do that is certainly around community spaces, community hubs, and that's things that we're doing. But you know, these informal environments are sometimes really useful places where people can also get information and sometimes can share information about what's going on. And also we want to have and train those people to basically have that capacity to be able to identify sort of what the issue is and potentially to direct people to the right space. So these informal sort of networks are really, really crucial, I think, as we sort of build this connected community, so we know more, you know. And I think through some of this work, what you were talking about earlier, how are we not finding out things much earlier, I think this will be part of that work, where we are able to understand issues happening at a much earlier stage through some of these informal networks that we're very keen to support as well. Thank you.
Great, thank you. So now Councillor Taylor for the last question on this item.
Okay, it might not be a question. I'll be honest, I'm waiting to be convinced, actually. There seems to be an element of, the way I'm perceiving this is like throwing something at it and hoping it will work. There are, and I may contradict myself in a second by having said that as well, because as Shani already mentioned, there are groups already out there as well, support networks as well. So I'm wondering how this might be different. Greenford, you've taken Greenford as an example. I'm trying to think, we're both acting councils, of course, how it might work given the high level of private renting we got as well, and therefore we haven't got necessarily a close-knit community as perhaps Southall or Greenford or Norfolk. But there are examples, in fairness, town cankers as well. I always remember there's boxing clubs are quite useful for young people. They have mental health issues, because I remember seeing one a couple of years ago and how they take on some of those issues. So potentially it's there. I guess one question is looking at some of these groups, could it potentially just be a group who lost out on funding 2 years ago, are going to apply, rebadge it and said we can fill that space, you know, on one level. The other thing is about neighbourhoods on the other side of it. I guess that may include council estates and how much work you might want to do with our resident engagement team and also housing association estates. And I think two other things is, one, there's a role for councillors. You know, we are crucial in this. People, I can't talk for the other colleagues here, but I know people perhaps in my demographic come to me for a lot of issues and trust as well. I remember maybe 10 years ago, my own temple in Greenford actually used example to do prostate tests because it was the stigma issues, and I said, well, I happily will front it up. So I'm not saying everybody does that, but the point is we have a role as that in terms of as community links as well, and I haven't really seen that in the paper. But the other thing is the final bit on the paper talks about how the measures cause and effect. That's not going to be easy to do, you know, in effect on resident satisfaction. It could be because, I don't know, we've dropped council tax by £100 or something, you know, that might be a reason for satisfaction. So that's a difficult one, but I've only taken one example in fairness there. So yeah.
There are a few things there to respond to some of that.
So in terms of the evidence that this works, this is a practice that is done in different parts of the country, and in fact in different parts of the world. The kind of asset mapping is what we're not trying to do. It's not a new approach that we're trying to impose on the community. It's more galvanizing and growing what's there and connecting that up. So what we're not trying to do is say we're funding a new thing that is entirely separate. It's really about surfacing the strengths and the people and making that more visible. So through the networks, the anchors, I think, compared to some communities, both in London and across the country, we have a variety of anchors, but perhaps they're less visible and less conscious of that role that they're playing. So part of it is kind of trying to celebrate that role that some organisations play and enabling more of that. So in Greenford, for example, in some of the conversations, so I've been having conversations with different people in towns. I met an elderly man who basically said, I used to love coming into Greenford town. All of my friends are now dead, and I come to this pub and I'm on my own and it's pretty miserable, but this is where I normally come. But he didn't know where to go for support and help, and he was living quite an isolated life. Now that pub is his anchor, but equally he should be connected up to other people in his area. And I spoke to the pub landlady and I said, do you know where to get support for people? I was like, well, he's my mate now. We look after him around here, which is fantastic. But she also didn't necessarily know where to get help and support for other things that that gentleman might have needed. And we have lots of conversations. And of course, councillors are at the heart of that. And councillors know lots of people and will be doing lots of that connecting. But how can we make some of that more systematic in our approach? And how can we call on that and make that really visible so that towns and local people know about that support in places? And how can we encourage those town anchors and places and spaces to actually say that's what they're about and do more of that? So some people know those places and spaces to go and other people don't. And then in our neighbourhoods, yes, some of them may be council estates, and we are already working on one of them. We're having conversations about what that would look with our resident engagement team and how we can build. So this isn't just about growing something separate, it's how we embed these kinds of processes within how we do things in the council, so that we're more systematic in building that and not just servicing specific needs, say about repairs. We take those opportunities to connect people up and grow that community power and space. So I hope that answers some of it.
Great, thanks very much. Good. So we're moving to recommendations. I think in general we endorse the work. I mean, I think we're happy to. I think, yeah, well, yes, even Councillor Taylor. Good, great, smashing, excellent. Is there a recommendation around using the work to inform the shape of future commissioning? Because I think that is actually rather important. Yeah, good. Yeah. And then thirdly, arising out of Councillor Taylor's questioning, I think there should be a recommendation about recognising the role for councillors as town anchors, or as a sort of I don't know whether you say there's something, but yeah, recognising that, you know, that councillors also fulfil that sort of role. Yeah. Sure. Yeah.
I'm coming back to what I said before, because it's not just councillors, it's each and every one of us. And it is about raising awareness within the community, and it's building that community. So I'm wondering if there's something that we could do about raising awareness and about people being present, because sometimes people will just, you know, not do anything and they can see it right in front of them. There's a problem, you know. So is there something we could recommend? I don't know.
Okay.
It's just a big.
Councillor Reyes, I was going to say I'm not sure what the specific recommendation was, but you put your hand up and then maybe you do. Yeah, I mean, I think it's a bit of both. I think councillors themselves have a community leadership role, but also the councillors definitely will know all the anchors in the ward, because they will. Yeah, absolutely. Yeah. Sorry, Carrie.
Just on this point, it is a community building approach. So it's not trying to, so the raising awareness through this approach, it is a way to build up that community. Some of it will be more fragile, and your knowledge and expertise, you'll know some of that thing, but how can we create more of those leaders and active community members to take this forward? So working alongside you, but to kind of create more of that community leadership and connection.
Yeah, so I guess, yeah, so we need to kind of formulate this into a specific resolution, don't we? Yeah. Sorry, Mike.
Sorry, but there'll be areas in the borough where you haven't got those natural leaders, which I think is where we as councillors can step in and fill that gap.
Well, yeah, I think we've got the councillors' recommendation in there. The one that we're struggling with a bit is Councillor Sharma's suggestion. Do we have a wording? As
enablers, I mean, like you were saying, Carrie, it's about enabling each other, something, and developing a community. Developing community. Those are the key words that struck out. I don't know.
But who's it a recommendation to? I guess the problem is who are we making the recommendation to? Because we can't really make a recommendation to people as a whole. So this is another one about councillors, then, you mean, or just the
example?
It's in the when you said about councillors.
Oh, okay.
We're enablers. Okay. We enable others.
Yes. Okay. So we could broaden that recommendation to sort of recognise the councillor's own role, but also to enable others. Yeah, that's good. Yes, that's right. So it's as anchors themselves, but also as enabling other people, isn't it? Yeah. Councillor Mataza, did you put your hand up a minute ago? No, you didn't. No. Right. So Councillor Rice.
Just thinking of add to that. I mean, what I say about the town teams, is that a way that we can reach out to particular people in the community and say, hey, here's your opportunity to do something. Just think about what is possible for you. I mean, that could be like another way of looking at it. Just how do you? I mean, some of the town teams, sometimes we're looking at trying to get people to apply for a particular type of project that's on a theme, but maybe we can broaden it out into more a case of just get out there and lead and just see what you can do. But
okay, well, I think we've captured it. Great, good. So that brings us to the end of that item, which is the last item on the agenda. So I'm the last bit of my script. I think the only other thing I was going to say was go to the next meeting. Yes, that's right. Yeah. So So thank you. Well, thank you to Kerry and Amanda. And Councillor Shani is still there, I think, and everyone attending. And the next meeting will take place on the 12th of March 2026, so quite a while into next year. So I was only slightly over 9 o'clock. Thank you very much, everyone, for your time. Thank you. Great.